The next step in the systematic interpretation of a 12-lead ECG is the interpretation of the axis. Remember from Chapter 1 when we talked about vectors. When we talk about the axis of the heart, we are talking about the ventricular depolarization vector. It is the overall direction of the depolarization of the left and right ventricular myocardial cells when summed together. The first thing that you need to know about axis is that it is measured on a Cartesian coordinate system, just like that we all learned in grade school. The x-axis is the same as lead 1, because lead 1 runs horizontally from the right arm to the left arm, with the positive end pointing towards the left arm, just like the x-axis on an xy coordinate system. The y-axis is lead AVF, because AVF runs vertically from the head to the foot. The only difference is that AVF is positive at the foot. This is the opposite from a standard XY coordinate system. Therefore, leads 1 and AVF are the only leads that you need to evaluate in order to determine the cardiac axis. Now let's talk about a normal axis. The normal wave of depolarization as the signal moves through the left and right ventricles is from the center of the heart towards the apex of the left ventricle. This occurs because the largest mass is the left ventricle. The right ventricle is relatively small, both in size and thickness, relative to the left ventricle. The total amount of cardiac cells are what determine the strength of the electrical signal. Therefore, the left ventricle carries the day for most patients. Since the left ventricle is oriented along an axis pointing from the right shoulder towards the left hip, this is also the normal axis of depolarization for the ventricles. A normal measurement for the electrical axis of the heart is between 0 and 90 degrees. If the axis is between 0 and negative 90 degrees, this is called a left axis deviation. If the axis is between 90 and 180 degrees, we call this right axis deviation. And finally, if the axis is between 180 and 270 degrees, then we call this extreme right axis deviation. Therefore, each quadrant of the Cartesian coordinate system has a defined label. The left lower quadrant, as defined by the patient, is normal axis. The left upper quadrant, again as defined by the patient, is called left axis deviation. The right lower quadrant is right axis deviation, and the right upper quadrant is extreme right axis deviation. Many textbooks will spend a lot of time trying to teach you other methods for further defining the axis of the heart. This is not a good use of your time, because the quadrants are not further defined any more specifically than the labels I have just given you. You can determine which quadrant the axis lies in simply by looking at leads 1 and AVF. Let's take a look at some practice ECGs. In this tracing, lead 1 is overtly positive. Remember that it is not only the height of the QRS signal, but its width as well. It is a question of the volume under the curve. Compare lead 1, which is mostly positive, to lead AVF, which is also mostly positive, but with a slight S wave at the tail end of the QRS. If we look at the total volume in lead AVF, it is still positive. However, it is less positive than lead 1. If lead 1 and lead AVF were identically positive, then the axis would be positive 45 degrees, halfway between 0 and 90. However, lead 1 is more positive than lead AVF. Therefore, the axis here is approximately positive 30 degrees. Here is a second tracing for us to practice with. Lead 1 is mostly positive. There is a very small S wave, but overall, the vector of lead 1 is remarkably positive. Lead AVF is overall negative. If you look, the width of the S wave and the depth of the S wave clearly together are greater than the height and the width of the R wave. Overall, the volume of the S wave is greater and negative than the volume of the R wave. Therefore, AVF is ever so slightly pointed in the negative direction. Combine the positive value in lead 1 with the somewhat negative value in lead AVF, and the axis here is approximately negative 20 degrees. So far we have discussed the concept of the cardiac axis in the frontal plane. By the frontal plane, remember, we are talking about transecting the body from head to toe, splitting the front half from the back half. Leads 1, 2, 3, AVR, AVL, and AVF all transect the body's electrical behavior in this fashion. When we talk about cardiac axis, we are referring to the mean vector of depolarization in the frontal plane. It turns out that the heart also has a mean vector of depolarization in the horizontal or transverse plane. Leads V1 through V6 transect the body electrically in that particular plane. If we look at V1 through V6, and we remember how the heart is positioned inside the body, the right ventricle sits most anteriorly, in other words, just behind the sternum, and the left ventricle sits more posteriorly, in other words, further towards the spine. Therefore, leads V1 and V2 sit mainly on top of the right ventricle. Since the main body of depolarization is the left ventricle, then the main vector of depolarization will be away from leads V1 and V2. In other words, they will be mostly negative. As we move around the heart in a horizontal plane from V1 towards V6, we recognize that the mean vector of depolarization moves towards V6. Therefore, there is a transition point where the vector of depolarization changes from mainly negative to mainly positive. The lead of transition is the lead from V1 to V6, where the QRS is equally positive and negative. In other words, it is biphasic and in a balanced fashion. In a normal heart, this transition occurs by lead V3 or V4. Let's look at the axis of this heart in both the frontal and horizontal planes. Lead 1 is mostly up, AVF is mostly up, and in a relatively balanced fashion, this is a completely normal cardiac axis. As we look in the horizontal planes, we look only from V1 through V6. V1 and V2 are mostly negative. V3 is the lead of transition. Notice that the R wave and the S wave are essentially balanced in lead V3. By the time we move to leads V4, V5, and V6, it is almost all R wave, in other words, all positive. Transition in this heart is by lead V3, which is completely normal.